Hey, it's Dr. Allo, the cardiologist, personal trainer. One of the questions I get a lot is, do carbohydrates give you diabetes? So the answer is obviously no. Eating too many carbohydrates does not give you diabetes. What gives you diabetes is having the genetics for diabetes and overeating and getting overweight and whatnot. We know that about 10% of the country has type 2 diabetes, about 1% or 10% of that has type 1 diabetes. Type 1 diabetes is not something we can really predict. It seems to be a one-off mutation or something where something suddenly triggers your immune system to kill your beta cells in your pancreas, and that's how you get type 1 diabetes. Type 2 diabetes is entirely genetic. Your mom or dad had to have diabetes in order to give you diabetes. That's kind of how it happens. Now, if you have the genetics for diabetes and you're eating more and you're overweight and you're inactive and all that stuff, then sure, diabetes will manifest in you. But the vast majority of our country is not diabetic. About 90% of people in the United States and the world are not diabetic. However, 80% of the United States, 82% is actually overweight, and about 42% is considered actually obese. So if it was the obesity and the overeating that gave you diabetes, then almost 80% of people would be diabetic, but they're not. So we know it's genetic. It's completely genetic. This has been described in studies long before obesity was even a thing in the United States. But definitely, if you have the genetics for diabetes and you're overeating and or on steroids and on overweight, eating, taking medications that worsen your insulin resistance, then you will definitely be diabetic. The ways to reduce that are obviously to get off as much weight as possible, get as close to your ideal body weight as possible. That will help you get off some medications. You may not be able to get off all of them. There are some type 2 diabetics that are so severe that even when they're rail thin, they're diabetic, but that's not a problem. You can still be thin and diabetic because it's obviously genetic. So I recommend weight training and those kind of things to help reduce insulin sensitivity, insulin resistance, and improve insulin sensitivity. And there's no amount of food that's going to suddenly magically make you diabetic. If you are diabetic, you are diabetic. Being more overweight and less active just makes it worse. If you have any questions, please feel free to ask them below. And I do have a YouTube channel where I answer this question more in depth.